My name is Teryl. I am 27 years old and I'm a patient here at Women's College Hospital. I am someone who appears relatively young, relatively healthy, and my story is about going through the healthcare system without a diagnosis, or in many cases, a misdiagnosis. On occasion, this has looked like me going to emerge and presenting with extremely high heart rates and other alarming cardiac and respiratory symptoms. In emerge, it was recognized that yes, these were very alarming and something that needed to be attended to, and something that needed to be attended to very quickly. However, when you get discharged from emerge, you're left with follow-up and follow-up care. However, follow-ups don't always go how you would plan or how you would expect. And there's always ways for you to get lost or to fall through the cracks. In one instance in particular, a doctor told me, "You're too young to have a cardiologist. No one your age has a cardiologist." My first introduction to Women's College Hospital was 2.5 years ago when I first moved to Toronto and was in need of a new family doctor. Dr. Lickblau gave me the opportunity to tell my story in my own words and from the beginning, and I don't recall ever being interrupted once. Another really wonderful thing that Dr. Lickblau has done and has been doing is that not only has he been sending referrals or making referrals for me, is that he's been following up on these referrals. One of them was to the cardiology program at Women's College, and from there I was enrolled in the cardiac rehab program. Yeah, before cardiac rehab started, I was almost in tears every time that I saw stairs. I was living in a high-rise condo and the elevator was never working, and I ended up having to move because I couldn't walk up the flights of stairs. The wonderful and dedicated staff helped me see that the focus of the program was to improve my quality of life through improving symptoms, and that was something that was achievable. And for me, this was really a new outlook for me.
My name is Debbie Childerhouse, and I'm a registered physiotherapist and program coordinator in the Women's College Hospital Cardiac Rehab and Primary Prevention Program. This program was started in 1996 by Jennifer Price, our advanced practice nurse, and Dr. Leonard Sternberg, our cardiologist. Our cardiac rehab program was developed through seeing gaps in healthcare. We hear still in 2019 stories of women going to emergency departments and not having their symptoms heard by emerge physicians and being sent home even while in mid-heart attack. Through a holistic approach with our team, which consists of nursing, physiotherapists, kinesiologists, dietitians, we look at the whole person and talk to them about their risk factor management. We take a cardiac rehab approach with putting the patient in the driver's seat of their health care. Much of our program comes from the voices of our women that attended as well. We hear a lot of the caregiver stress that women are coming through, even just being able to come to our facility once a week. So we do pride ourselves in really listening to the patient's stories, validating it for them, and then helping them come up with solutions.
So at Christmas this year, my niece, who was 6 years old, gave me a new heart for Auntie T. And I've since given this gesture so much meaning. As a recent graduate of the cardiac rehab program in December 2018, I do feel as though this program has given me a new heart.